Hello and welcome. I'm the Courage Doctor, Ernest G. Hope. I'm an MD PhD from Stanford University, and I love helping people like you with cancer. Somewhere in the family, you might be the patient, you might be the person taking great compassionate care of somebody with cancer, and I learned over many years how important support is for cancer. So we are here to help, and I'm specializing in aggregating from all of these great colleagues of mine from Stanford, or they're at Harvard, or the name doesn't even matter that much. These are great physicians. They all trained at great places. They might be in their own practice, or they might be doing cutting-edge research. But I love to bring help and the dialogues between doctors and patients, which has died out or which has become very focused on this is the next treatment. I'd like to give it depth, substance, and I want to inspire you to be really ambitious about any situation in cancer. To me, cancer is curable today as we film this in 2014. We have seen, in my personal experience, many people turn around from even stage 4 cancers, and the knowledge how to do it, which used to be a top secret, a Hollywood insider secret, we have now put forward in the book The Courage Method for everyone. And for less money than it takes to gas up your car at a gas station, you can now get literally thousands of dollars of experience. So please go and read up. We've put this out for you and you in your community to really have good answers. And let me highlight what we're going to do, because I want to teach and help understand how does cancer work, and I want to teach it to you. We have stage 1 cancer. So stage 1 cancer, the cancer is confined to the original organ. Cancer has not yet spread. Surgery can certainly cure cancer if it gets the stage 1 cancer out. And that makes stage 1 special. There are some cancers like breast and prostate where we have a full program in which this is not always the case. And there are strategies you need to know if you're in stage 1 cancer with breast and prostate. But I wanted to give this as a first overview. The stage 2 cancer is invading, but it's invading locally. So it's a cancer which sits in an organ and it's spreading locally. And it has, however, not yet invaded blood vessels or the lymph nodes or out of the organ. So it's actually relatively confined. And again, surgeons will do their best in trying to catch the cancer there. We have stage 3 cancer, when the cancer is actually invading not only the organ, but it just comes out of it and it's reaching for neighboring organs. It's locally invasive, and depending on the stage, it is often invasive into lymph nodes as well. But typically, the cancer still sits at one part of the body where a local focused intervention can get it all. And there's a lot of new technology available now to help with pushing from pretty good to a real true turnaround. And then there's stage 4 cancer, and so much has changed in stage 4 cancer that it is a really fascinating area. It used to be a so-called death sentence. It's not anymore. Stage 4 cancer is simply cancer which has spread to unrelated organs, and it grows aggressively. But now, as we film this, we have good news. The knowledge in medicine has exploded. New treatments are out there, but there is a gap between the knowledge and a gap between you as patients, you as patient families, so you can't yet put it to use even if it's available. And so my role is to teach what is going on. In stage 1 cancer, you will need to learn how does staging work. Is this truly a stage 1 cancer which you have? What does it mean? So what is it exactly as stage 1 cancer? You want to know that when the surgeon said, they got it all. Now what? Do we do maintenance chemotherapy forever? Is it safe not to do it? Really important questions. And you want to know special considerations. Other stage 1 cancers and you might be in that situation and not know, where you really need to be much more on the guard and do more proactive steps than in others. You want to know what is your next step, and we're very glad to teach this. And so there are resources out there which we brought together, and the link under this video will guide you to a full 45 minutes plus of in-depth instruction on stage 1 cancer. And if you have stage 2, stage 3 or stage 4 cancer, please go and tap into these amazing resources at your fingertips, and you will see me there going into great detail so that you will know how does cancer work and what can be done about it in the most intelligent way. Hint, chemo, radiation and surgery is the old way. There is a world outside and out there, and I'll be glad to be your guide and walk you through so that you can, in a couple of years, say, I had the complete cancer rescue and it was an amazing adventure. Invest in knowledge now and your race with cancer will be successful. Go check out these additional resources and watch for more. We are here to stay to bring everything we find helpful to you. I'm the Courage Doctor. It's a pleasure to help you in your race with cancer and help you win.